welcome back. This is the 31st annual New York City IAS-USA full day CME program. Those of you that have been here before remember when we had to say, oh, you know, if you have a seat next to you, raise your hand. People will come and they'll find a seat. We're not quite back from the pandemic yet, but we think that it's going to keep increasing. We're this year not having a remote option, so we're really trying to see if people are willing to get back together and say hi to each other and work together. We hope so, because I think there's some advantages to being able to interact. We're going to give you a chance to ask questions today, and we hope that there's a good chance for some discussion. I'm Paul Volberding from San Francisco, and this year Elaine Abrams from New York, from Columbia University, is my co-chair. This is the first time, I think, that Jerry Friedland has not been the co-chair. Next year I won't be here either. There is a change of the guard happening. I might be here as a member of the audience, but we think it's time to start bringing in some newer folks, some younger people, to make sure that the organization and the program that we present is really, hopefully, exactly what you need. So this is the Scott Hammer annual update. We did that to honor Scott, who, as a lot of you know, was a real leader in our field, who died just a couple of years ago now. And so this is now the Scott Hammer course. Could I have I guess I'm controlling things here. The organization, International Antiviral Society USA, does a number of programs. We've really tried to flex with the pandemic. We've added a lot of virtual content for our programs. A lot of you have participated in our dialogues that we do on a regular basis, especially around COVID issues. We've done a number of webinars. We'll continue that, and through our website you can always see, learn more about us and about our programs. The IAS-USA also, for a number of years now, has been the manager of the CROI conference. We know that many clinicians can't make it over to Seattle or wherever the CROI conference is this year in Seattle, so we're going to make sure that the speakers today bring you up to date on highlights from the conference, which again we help manage. Again, these are the two chairs. That's me in earlier days. I was already losing my hair, but that's continued. Elaine Abrams, who is fortunately not losing her hair. Hi. And again, this is dedicated to Scott Hammer. It's back in person, full-time in person, and this is the first time our organization, which again manages CROI, has done one of these programs, so it's a chance to see how much our speakers have learned from CROI and how they're able to teach our audience. The audience today includes people from all over the place. We think probably a number of these sites are from where speakers arise, but we know that people do come from a number of other places. So we are an ACCME provider. We will talk about that in a second, but that requires that we try to make sure that we're monitoring how effective we are in our programs. We want to send people back to their practices, better able to handle their patient needs. That might mean changing your practice if you learn something that changes how you're managing a problem. It might mean sending you back freshly, kind of reassured that what you're doing is the appropriate thing. And this is the pre-activity knowledge assessment where you've taken the tests, and we love this. About 50% pass and 50% fail. That's just perfect because that gives us a target, and at the end of the course, we'll test you again to make sure that you've learned what we were trying to convey. We've asked the speakers to make sure that they hit those topics that were part of your preclinical assessment. When they give their talks, they'll probably say something like, listen up, this was on the pre-test quiz, so pay attention. As I said, we are accredited by the ACCME, and we have, over the years, certainly broadened this beyond just CME for physicians. You get, the docs that are here get 6.5 hours of AMA credits, but we also offer other forms of recognition for your participation. ABIM, nursing, pharmacy, and pharmacotherapy credits are also provided. We are grateful for the support that we receive from the pharma industry. That's shown here. Just a little bit about the IAS-USA philosophy. From the time that we started back in the very early 90s, we've tried to maintain a very high firewall between the funders for our programs and the choice of the speakers, topics, and content. We have no influence, and we will ask you in the assessment of our course if we're achieving that. If you detect any sense of a bias, do let us know, because we really try to avoid it. We will reveal conflicts or relationships with companies during the program. I'm going to make sure that I'm not. Tell me when it's time to tip over. Okay. And then the presentation slides will be available following the course, and handouts are available in your syllabus. I think this is the time when I turn it over to my co-chair, Elaine.
Great. Thanks. So, hi everyone, welcome, and I'll continue. I'm sure you're all well acquainted with using QR codes. We'll use them to access Slido, to submit questions to the presenters, and to answer polls. We'll also have mics if people want to ask questions directly, which I think we'd all prefer. So we'll practice, ask you to take out your phones, use the QR code, and answer this practice question. So we'll be doing this for the polling. I see people answering, but I don't see the number coming up here. Okay. Raise your hand if you've answered. No? You see the number supposed to, oops. The number's supposed to come up at the top. I'm not seeing the number. Well, I'm glad we're practicing before we get to the polls. Should I go on? Okay. We'll have this working by the time the real thing happens. So we'd also like to acknowledge fellows and trainees who are here today. So if you're a fellow or a trainee, please stand up just so that we can give you some acknowledgement. We're always happy to see people continuing to develop their interest in this area. I'm sure you've all been through the agenda. We have experts from all over the country who came in last night specifically to be presenting to you today, and we're really quite pleased that they're here with us today, and you're going to have some fantastic talks. I want to point out that we're going to increase the break at 10 by another 5 minutes to do some technical updates. This is the second half of the day. And as Dr. Volberding has already mentioned, this is his last time moderating this course that he has brought to us, and I can say that it was a very important course in my early days, in my training, keeping me up to date, particularly as a pediatrician, trying to keep up what was going on in the adult world. And I think that this course has really been quite essential in the management of patients for many, many people over many decades. You'll see that we celebrate the course and particularly Dr. Volberding over the course of the day. We want you to join in this celebration.